A 50-year-old man presents with abdominal discomfort and diarrhea. The symptoms began 6 months ago, and he has developed significant weight loss. Intestinal biopsy is performed, and a periodic acid shift stain section is shown. Which of the following is the most likely cause of this patient's symptoms? Now, this patient is presenting with abdominal pain as well as malabsorption. He has diarrhea as well as significant weight loss. And the biopsy is showing us foamy macrophages in the intestine. And these are going to be characteristic findings for Whipple disease. And the bacteria that causes Whipple disease is going to stain positive for PAS stain. So this is also going to be consistent with our findings. So the answer to this question is going to be answer choice A, which is a chronic bacterial infection. Now, Whipple disease is really important to treat because it can be lethal if left untreated. And the way this bacteria is going to harm us is when it gets to the body, the intestinal macrophages are going to engulf it. And this bacteria basically inhibits the formation of a phagolysosome. So normally macrophages are going to phagocytose pathogens, and the lysosome found within the macrophage, which contains lysozymes which ultimately kill the pathogen, has to be fused with the phagosome to form a phagolysosome. So this step does not occur, and as a result, we also don't get the presentation of the pathogen to our other immune cells. And as a result, the bacteria is basically going to keep accumulating within the intestinal macrophages. And so over time, they're going to keep on accumulating and ultimately block the lymphatic ducts within the small intestine. And so, as a result, we're not going to get transportation of nutrients from the small intestine into the blood because these lymphatic ducts are blocked. And so, as a result, we get malabsorption. Now, the bacteria is also going to mess up lipid metabolism within macrophages. And so, that is why we get these foamy macrophages on the histological slides. Now, first aid had some good mnemonics to remember some of the features of Whipple disease. So I just kind of put this as a reference. So the mnemonic that they had was pass the foamy whipped cream in a can. So the pass is to help us remember that this bacteria is going to stain positive for PAS stain. And the foamy part is to help us remember the appearance of the macrophages in the histological slide. The whip part is to help us remember the Whipple disease, and the can part is to help us remember some of the symptoms that can manifest with this disease. So we're going to have cardiac symptoms and neurological symptoms later on in the disease process. And the bacteria can also spread to the joints and cause arthalgias. And first aid didn't have abdominal pain as a second A, but I put it here just because it is such an important finding for Whipple disease. So hopefully this video helps. Thank you for your time.